Dr. Goldfischer has a little bit of a different practice background, being the LUGPA president in a LUGPA and everybody else being the university-based or Kaiser-based system. Please, Dr. Goldfischer, share your thoughts.
Sure. Thanks very much, Jay. So I think Zach and Ron both made great points. We all have more business than we know what to do with. As president of LUGPA, I've been able to travel around the country, and I've seen a lot of stuff, but the one thing I've never seen is an empty urology waiting room. I don't think it exists. And Kristen makes a great point. This is an invasive test. And when you talk to a cystoscopy, particularly to a young male, they cross their legs and they're like, really? Do I have to have this done? Do I really have to have this done? And they start to ask about anesthesia, which is just not practical, right? And, so we saw during COVID, where we were limiting our office visits and our office procedures, we really had to be judicious at that time as to who underwent a cystoscopy in our office because of all the restrictions that were placed upon us. So I think this test is really just an extension of what we all started to realize during COVID. You can't do a cystoscopy on everybody. And I think the gastroenterologists are a couple years ahead of us. While it's not an exact comparison, a lot of patients who are very low risk for colon cancer choose to undergo a Cologuard test instead of a colonoscopy. They want to avoid the anesthesia, the day off from work, the prep. And for most low-risk patients, a Cologuard is a reasonable option instead of an invasive colonoscopy. So that's, in my mind frame, that's how I'm looking at this test. For low-risk patients, this is our version of a Cologuard. Allows improved office flow. As Zach pointed out, we can see the patients who really do need to be seen and really need a workup, but we're not forgetting about these patients. They're still getting an appropriate test and appropriate workup. And yes, if it comes back positive, obviously, we're going to change our management. But for most patients who come back negative, they can avoid a cystoscopy and avoid an invasive procedure.